Thank you very much for the introduction. Thank you for coming and thank you for your interest in our study. The purpose of our research: Hodgkin lymphoma is the most common malignancy amongst young adults. So median age at onset of the disease is slightly above 30 years, 32 years. These are young people, and treatment for patients with advanced stage disease, and half of the patients suffer from advanced stage disease, is very intense in order to cure them. The standard of care within our group is 6, or it used to be 8 cycles of escalated BIACOP, which is a very intensive chemotherapy regimen. It's very effective, it's very well known to be very active. However, toxicity of this regimen has been and still is a matter of concern. We know that individual patients might be cured with less burdensome treatments. However, we can't predict who is the patient in whom we do not need that much treatment. In this trial, we investigated whether metabolic response, early interim metabolic response assessment by PET, so FDG, PET, and CT after 2 cycles of chemotherapy from a total of 6 or 8 would allow us to select patients who could be treated with less cycles, who have a lower risk because they are responding nicely to the treatment. This is a prospective and international trial. It's a phase 3 trial with 5 European countries contributing to this trial. It's Germany, Switzerland, Austria, Czech Republic, and parts of the Netherlands. We enrolled more than 2,000 patients in this trial. It's a huge trial, between May 2008 and July 2014. They all were suffering from newly diagnosed advanced stage Hodgkin lymphoma. 1,005 patients have been PET negative, so the others are PET positive. Today we are talking about those patients responding nicely to the first 2 cycles and then have a PET negative finding after 2 cycles. And they were randomized then between 8 cycles or 4 cycles only. So we reduced the treatment in these patients to 4 cycles only. And we aimed to show that these 4 cycles are non-inferior to 6 or 8 cycles, to the more intensive treatment. That's the aim of the study, to show non-inferiority. The result, very briefly summarized here, is that what we found is that indeed only 4 cycles are non-inferior to 8 or 6 cycles, which became standard of care during the study, in terms of 5 years progression-free survival. And this is true at a very high level. So the progression-free survival at 5 years is 92.2% versus 90.8%, and the difference is in favor of the less intensive treatment. So it was not even as good, it was even better. This is not significant, but this was not the aim of the study. We just wanted to show that it is not inferior, and it certainly is not inferior. We can safely conclude that 4 cycles are in this patient cohort as active as even 8 cycles. However, we had much less toxicity. And this then translated into an overall survival benefit. This was a secondary objective of our study, not the primary objective, but we found that more patients survived with a less intensive treatment, and this again at an extremely high level, so it's close to 98% at 5 years. Indeed, we have seen only 0.7% dying from Hodgkin's lymphoma. From 1,005 patients, only 7 patients died from Hodgkin's lymphoma. So we can almost say we have eliminated Hodgkin's lymphoma as a relevant cause of death in these young patients suffering from this cancer. We had fewer severe infections, as you can see here. We had less organ toxicities just due to the reduction of treatment. We have very few patients with second neoplasia, including acute myeloid leukemia. It's just 2 out of more than 500, it's 0.4%. And we have no treatment-related mortality at all in this trial. Usually some of the patients, this is part of our treatment, have very severe side effects. They have infections and they can die from treatment. So the number is in between 1% and 2% in our trials. But in this trial, not a single patient died when treated with 4 cycles only. So what we conclude is that this is a very effective treatment, obviously. You have heard the numbers. Almost all of the patients will be cured. And it's very safe. Not a single patient died. It's short, and this might matter. Standard of care took more than 24 weeks, and other treatment regimens also take more than 24 weeks, and we are down to 12 weeks, and this might matter in this patient population. These are young patients who usually go to work, they start their career, and if they are off their normal life for just 3 months or 6 to 8 months, this might matter. And we have seen an improved quality of life in our cohort for the patients treated with lead therapy. And we therefore strongly recommend the PET-guided escalated BU strategy for patients with newly diagnosed advanced stage Hodgkin lymphoma.